I sat next to a doctor who works with a lot of cancer patients at dinner the other night, and she was sharing how, as she's gone further into doing this work, she's really focused more and more on the emotional side of things. And I'm just wondering, what are your recommendations for dealing with that? And obviously you have, your background in Chinese medicine, so I'm sure that informs some of it. So what are some of the ideas that you would bring forward in that end?
Well, from the beginning, the patient wants to be seen as a whole person and deeply listened to, and that doesn't always happen in the oncology setting. That by itself is important, so we give that. I also encourage patients' support system to come to the visit or to be with them on a Zoom visit, and that's important too, so that the people that are helping and caring for the patient really feel that the message is clear. And patients retain about 10% of what the doctor says to them. So if they have family members or primary friends or family members, significant others with them, their kids, then it's really a team approach. Nobody can go through cancer by themselves, so having that support system is really important. Some cancer patients feel like they're supposed to go to bed and rest and don't understand that staying engaged in life and exercising and staying active in their life is part of their well-being. A lot of relationships change when you get diagnosed with cancer. So there's this psychosocial part of it. But then there's the spiritual and existential part of facing one's mortality. And I am quite comfortable talking to patients about end of life, mortality, death and dying. I'm comfortable. So if there's somebody in the room that's comfortable, that is helpful. But also my job is to help the patient build their team. So if they need psychosocial or spiritual support, if I can't, in my conversations, my intimate conversations with them, be that person, then it's my responsibility to make sure they have the right team for that part of their journey as well. Yeah.
So what does an optimized integrative oncology team look like?
I'm like, what's the right tool for the job? And whatever universe that comes from. So for some patients, that might be surgery or chemotherapy or immunotherapy. Natural therapies don't have a powerful cytotoxic tumor burden reducing effect. And so sometimes if there's a lot of tumor burden or very aggressive cancer, we need those big guns. We need those therapies. So I want the plan always to be highly individualized. And standard of care oncology is not. So I may argue to the oncologist for more specialized tumor analysis to make sure that we have the right treatment for them. I also want it to be in the right timing for the patient. So the oncologist will often hurry them up, but cancer is not an emergency, it's not urgent care, it's a chronic syndrome. So I want the patient to be ready psychologically and energetically and just have their life organized to be able to do something hard and have a good outcome. So all those pieces, there has to be food therapies and dietary therapies in place for the unique nutritional needs of patients, make sure they don't lose muscle mass and lose weight and are able to digest their food. That has to be in place. I use a lot of nutraceuticals and botanicals with the intent to inhibit the metabolic aggression of the cancer, with the intent to turn on cancer suppressor genes and turn off cancer promoter genes, which we can do with plant medicine and food, and to just basic things. A lot of patients need help with sleep, healthy sleep cycles, and understanding, they should keep exercising. Patients who have had surgery, often their bodies are deformed and they've lost a body part. A lot of patients feel very self-conscious about that. Intimate and sexual relationships change for patients, and so there's a lot of things to talk about. So listening to the patient is very important to see what's most important to them and to speak to that. And then as I get to know the patient, as I read their pathology reports, do more labs on them, we keep fine-tuning it so it becomes more and more individualized. So if you have a patient who's a diabetic and a cancer patient. You have a patient who's an autoimmune patient and a cancer patient. You have a patient with a history of depression and they have cancer. The needs are different. And so you have to put that in the treatment plan. And so that's the beauty of doing individualized care.